In the realm of global health, few names carry as much weight as Bill Gates. But how did a tech mogul become one of the most influential figures in public health? Let us explore the timeline of Gates' transition from Microsoft to his current role in shaping global medical policy. It all began in 2000 when Bill and Melinda Gates established their foundation. With an endowment of over $50 billion, the Bill and Melinda Gates Foundation quickly became the largest private foundation in the world. But what were its goals, and how far did its financial reach extend? The foundation's primary focus was on enhancing healthcare and reducing extreme poverty globally. But it didn't stop there. Gates forged partnerships with major health organizations like the World Health Organization GAVI, COVAX, and CEPI. He also became a regular at the World Economic Forum. Was this the beginning of a new era in global health governance? As the foundation's influence grew, so did its donations. Universities and governments in Canada, the UK, and across Africa received substantial funding. But what strings, if any, were attached to these generous gifts? In 2015, Gates gave a TED Talk that would later become the subject of intense scrutiny. He spoke about reducing population growth through improved healthcare. But what did he really mean? And how would this statement be interpreted in the years to come? Fast forward to 2020, as the world grappled with a global pandemic, Gates found himself at the center of a storm of public reactions. Trust in his expertise clashed with fear of his influence. How did the man once known primarily for Windows become such a polarizing figure in public health? Gates' statements became fodder for misinformation and conspiracy theories. Social media platforms like YouTube and TikTok buzzed with conflicting narratives. But what was fact, and what was fiction? And how did this digital noise affect public perception of global health initiatives? The debate around private influence in public health got more intense. Critics questioned whether it was appropriate for a private individual to wield such power over global medical policy. Supporters argued that Gates' wealth and influence were being used for the greater good. But who was right? As we reflect on this complex issue, we are left with a crucial question. Should one person have this much influence over global medical policy? Is this the face of modern philanthropy, or a concerning concentration of power? The story of Bill Gates and his role in global health is far from over. It's a narrative that continues to unfold, challenging our perceptions of power, philanthropy, and public health. As we move forward, it's crucial that we remain informed and engaged in these important discussions. What do you think about Bill Gates' influence on global health? Is it a force for good or a cause for concern? The answers may not be simple, but the questions are certainly worth asking. After all, in a world where private wealth can shape public policy, it's up to all of us to stay vigilant and informed. As we conclude this exploration, remember that the intersection of wealth, influence, and global health is a complex tapestry. It's up to each of us to examine the threads carefully, question our assumptions, and contribute to the ongoing dialogue about the future of public health governance. What role do you think private philanthropy should play in global health? And how can we ensure that the pursuit of public good doesn't compromise democratic principles? These are the questions we must grapple with as we navigate the evolving landscape of global health in the 21st century. Find more at DarkReveal.official.